our daily briefing on the status of coronavirus in our country. Yesterday, His Excellency President Uhuru Kenyatta outlined a raft of new measures to contain the spread of coronavirus in the country. Such measures, among others, include the restriction of movement into and out of designated counties of Nairobi, Mombasa, Kwale, and Kilifi. It is important that we all, as Kenyans, adhere to these measures if we are to score significant gains against this monster and keep our country safe. Each and every one of us, and collectively as a country, we are now called to observe and watch over these measures. Let us not shy away to point out those in our midst who are not observing the measure and thereby putting the nation at risk. In line with the pronouncement by the President of the importance of wearing face masks, let me reiterate that it is critically necessary that every Kenyan wears a face mask whilst in public spaces. Everyone must make the effort to get a mask to protect themselves and others, as we endeavor to provide them some where we can, free of charge, through our county governments and other partners. The measures announced so far call for drastic change in the way we live and the way we behave. It is not convenient, ladies and gentlemen, fellow Kenyans, but we must not be afraid to embrace that which will save us from the danger lurking around us. We are at war with an enemy that is invisible. To fight this enemy, more than ever before, we must remember to embrace simple and basic measures which have proved to be effective elsewhere and have been cited as best practice. These include washing our hands with soap and running water, as well as keeping social distancing. Let me say this: we will not hesitate to take even bolder measures in the coming days. The virus is already here with us, and we cannot run away from it. It is around us, and we have embarked with it a chasing game. Should we allow this to happen, it will be very, very difficult for us to catch up with it. I want to take this opportunity to once again thank our healthcare workers in public, private, and mission hospitals who have worked tirelessly and sometimes under very difficult circumstances. We would not have been able to make the gains that we have had it not been for their dedication. Being our frontline heroes, I want to assure them that we will do everything possible to provide them with every facility that is necessary to enhance their performance. I also want to thank the Ministry of Transport, Infrastructure, Housing and Urban Development, and the county government of Mombasa, and indeed their governor, Governor Joho, for the collaborative effort to provide disinfectant sprayers at Likoni Ferry. Such efforts contribute to the overall measures by the ministry to fight the virus. I would like to encourage other counties to also come up with innovative ways to complement the national government efforts. In the same vein, I also want to take the opportunity to recognize the efforts by the Ministry of Information, Communication, Technology, Innovation and Youth Affairs, together with the Ministry of Education, as well as the Kenya Institute of Curriculum Development, for introducing new education-oriented programs on television and radio to ensure that our children are productively engaged during this period. Further measures to enhance social distancing that we are going to institute must now include even the following. Number one is that in sporting clubs, open-air sporting clubs that have walking fields and so on, must strictly observe social distancing. We have seen people walking, and yes, it is necessary that people also stay healthy, but we must observe social distancing. We have observed in some walking clubs where people are running next to each other, and there is no better way of passing this virus than when they do so. So I would like to ask, and I would like to reiterate, that the managers of those walking clubs must restrict numbers in the club so that people do not, people can be able to keep social distancing. This measure we are going to observe for the next couple of days and may then take further measures if it becomes necessary. You are aware, it's not a secret that even in golf clubs have also been abused. Consequently, all golf clubs must be closed with immediate effect. Golfers are free to walk, keeping social distances, but there will be no candies in any of those golf clubs. In this particular case, it is actually the reverse. It is the members who will eventually pass the virus to the caddies, and therefore golf clubs will remain closed and the clubhouses will remain closed. Further, testing of all health workers and medical staff, including those in private hospitals, rapid response teams, and all staff in all facilities holding quarantined persons must commence testing with immediate effect. I would like to report that we are lucky that we have started rapid testing in our facilities because we have got new reagents that can allow us to automatically test and not do the manual test that we have been doing. And for that reason, we will be able to carry out those tests very quickly. But it is important that we start with our medical staff, even as we fight to ask them that to be careful. We must also now ensure that we do not have medical staff who are also treating people when they have got the virus and therefore passing the virus to citizens. So we must do that with immediate effect. I am pleased to report that over the last 24 hours, three patients who had been diagnosed as positive have been released from our facilities, having turned negative. However, in the same 24 hours, we have tested 696 samples, out of which 14 people have tested positive for the disease. 12 of the 14 are Kenyans, while 2 are foreign nationals. Of the 4 cases, four cases have a recent history of travel from Tanzania, South Africa, UAE, and the United States. 4 of them are from quarantine facilities, while 10 were picked by our surveillance teams. This now brings the total number of those who have tested positive for the disease in Kenya to 172. The 14 people that I mentioned have already been moved to isolation facilities, and contact tracing has begun earnestly. Let me just say this, that my friends, fellow Kenyans, let us brace ourselves for bad news. Let us be ready, because all the measures that we are going to take will not stop the disease abruptly. It is already here with us. There are two things that are fortunate for us. One is that the disease that Kenyans are getting is very mild. We have been getting very mild infections, and I'm going to ask Dr. Amos to say a little bit about that. As you can tell, the mortality rate for us has been quite low. But this is no reason for us to be relaxed at all. As we said earlier, we are praying and hoping for the best. But clearly, we must also prepare for the worst. And mentally, we must prepare ourselves to face an insurmountable situation. We must all work together. As I said last week, we are akin to a boat that is sailing towards a massive storm. And we must brace ourselves and be ready mentally. When you go to quarantine, it is very challenging. It is mentally straining. And we are having issues with people who are in quarantine facilities. It is not convenient at all. And my apologies to them for all the inconveniences that they are going through. But it is necessary. So, my fellow Kenyans, we must brace ourselves, mentally be prepared to face a situation that we haven't faced before. But I also know another thing. I know that we will pull through. I know that we are working together. I have seen effort from quarters that we would never expect. I have seen support from all over. And I have seen people helping each other. That is the way we are going to overcome it. We have now, out of the 14 people that I mentioned, for instance, 7 are from Nairobi. Mombasa has 2 new ones. Machakos has 1. Kisii has 1. Kiambu has 1. And Mandera has 2 cases. And the 2 reported cases from Mandera is a recent travel from Mombasa County. That explains why the decision by the president was taken yesterday to close some of the areas where we feel people moving into and out of are causing further spread of the virus. With regard to contact tracing, a total of 1,928, and by now nearly 2,000 persons have been monitored. We have increased our capacity and our ability to monitor these persons and trace these people. Out of those, 1,415 have been discharged, having tested negative, and 513 are currently on follow-up. To date, we have managed to test nearly 5,000 people. I'm also pleased about the cooperation we are getting from members of the press, members of the media. We are happy that you continue to carry out education, to carry out information, and to keep our people informed about the measures and the necessity of those measures. So please, we ask that you continue to do so. And as I said, we must be ready. This is not going to be a short term. It is not going to be a short-term activity. We are not going to be dealing with this disease only for the next couple of weeks. Let us brace ourselves for the long term. And by a long term, I mean for the next couple of months. We know that people are inconvenienced, for instance, in traveling into and out of Nairobi. We are aware of the inconveniences that happened yesterday, but this is the only way. It is the only way that it can be done, and that is what other nations who have managed to contain the disease, or who are containing, because it is not stopped anywhere. But where they are containing it, these are the measures that they are taking. Kwa hivyo, ningetaka tu kusema, kulingana na vile rais, wale walisoma hotuba ya rais na kusikia hotuba ya rais, yeye alisema vile tutafanya, akasema counties za Nairobi, na Nairobi ni Nairobi Metropolitan Area, Kwale, Kilifi na Mombasa, huko ni lazima watu wakae ndani ya hizo counties, hakuna kutoka. Na pia vile vile wageni wale wangetaka kuja kutembea, kututembelea Nairobi, tafadhalini mtangoja siku ingine, siku 21 kabla hamjaingia Nairobi. Watu wa Nairobi, ndikuwa nimesema hapo awali, ni lazima tukae Nairobi pia, hakuna kutoka hapa, kwa sababu tukianza kutembea huko Ushaguna kwingineko, tutapeleka hii virusi huko. Kwa hivyo kama mimi nasema kila siku, lazima tujikinge, lazima tujitayarishe, lazima tujue ya kwamba hii sio kitu inakuja ipite haraka haraka. Tukiangalia mbele, tunaona ndio tutafanya chochote tuwezavyo ndio watu wasije wakaumia ama kufa. Lakini ni lazima tujue ya kwamba kama vile nchi zingine, kama vile kumefanyika nchi zingine, ni lazima pia tuwe tayari hapa katika nchi yetu ya Kenya, kwa sababu tunaona vile kunyafanyika kwingine, na pia tunajua hata hapa pia kutafanyika. Kwa hivyo nataka kumsihi kila mtu, tafadhalini ni tufanye vile serikali inasema. Tufanye vile serikali inasema. Usijaribu. Usione wewe kama ni mwelevu sana. Hii virusi haina mtu mwelevu. Hii virusi ukicheza nayo sio uelevu, ni ujinga. Asanteni sana.